Welcome to Healing from the Ground Up. I'm Dr. Eric Greenleaf, and these are conversations about therapy.
Hi, I'm Michael Hoyt. I'm a psychologist here in Marin County, and I'm here with my two colleagues, Dr. Eric Greenleaf and Dr. Terry Suhu, and we're going to continue our discussion of modern brief therapy. We thought today maybe we could talk about some different cases, and each person would talk about a case, and then we'll discuss it from our different viewpoints and give listeners an idea of how we think about working with different kinds of clients. Does that seem a good idea?
Great. Yeah. Mm-hmm.
Eric, were you willing to go first?
Yeah, I'm willing. And I have two very brief cases, both cases of promises. And they're both young women who had kind of an aura of being possibly suicidal. Or at least I had the sense that I might be subject to a suicide attempt at some future time from them. So the first one, young woman comes in and she's a couple of weeks away from moving to another state. And this was all before computers, so I figured I would just see her once, perhaps, and then she'd be gone. But I had an uneasy feeling for reasons I can't remember. And I said to her, there's a shop down the street from the office where they sell old postcards. And I'd like you to go and buy a bunch of them. They're very inexpensive. And I want you to promise me to send me a postcard every week in perpetuity. And on the postcard, I want you to write, "Dear Eric," and then your name. Let's call her Jane. Jane is a beautiful woman, and sign your name and send it to me. Will you promise me? She said yes. And every week for about 3 years, I would get a postcard that say, "Dear Eric, Jane is a beautiful woman," and she'd sign her name. And then one week, she sent me a card that said, "Jane is a beautiful woman who's not depressed anymore. Mm-hmm. And she's met a wonderful man, so she won't have to send you postcards. Signed, Jane." So that was one case. The second one happened when I was teaching in China, and woman stands up and grabs the microphone in a death grip. And everyone looks, and she says, "My mother hurt me when I was little, but that's not why I'm asking this question. I don't trust anybody, so I don't make relationships, but I feel terribly lonely." And in front of this big audience, I said, "I'd like you to promise me something. Will you do that?" She said, "Yes. I want you to promise me that you will think all this through thoroughly. Will you promise?" "Yes, I will." And then for the next days of the conference, everyone in the audience looked over all the time to see if this young woman was still there. And she was. And at the end of the workshops, she came over with tears in her eyes and said, "I think I'm beginning to start to trust a little bit." So those are the two cases of promises in the face of what I at least felt was a possible suicide. The second woman being angry, determined, smart, and I was afraid, I think along with others, that she would walk out and say, "Well, that's it, I'll show them," and do something to harm herself.
they're both very interesting, and I see a certain similarity, perhaps, which is, well, a couple of things. One is, in both cases, promises. In both cases, you had to worry about her, and something bad might happen. She might do something bad. She was troubled.
Yes.
And somehow you had the sense that you could get her to honor a promise. So there was some kind of an alliance. And in both cases, you bought time. The first woman's going to send you a card every week for 3 years, or
No,
however.
every week in perpetuity.
In perpetuity, forever. So she has to keep at least once a week thinking a positive thought. I'm beautiful, I'm good, whatever, and sending it to you. And it maintains a connection with you, that she knows you're getting them. It's not just send it to me through the ether, but actually write it out in your handwriting before computers, mail it to me, all of that. And it's shifting her into having to do something positive instead of thinking about being unhappy or what's gone wrong this week.
Yeah.
Give me some good news every week. I'm a beautiful person, or whatever the exact words were. One of the things that intrigued me was, what gave you the sense that she would honor her promise? That she wouldn't just say, oh, I told him that, but heck with it.
I don't know. I think it, the commonplace, I guess, and I think it's a real explanation, I was very sympathetic. And the other thing I think is operative, or at least the way I think about these things, if somebody fears suicide, that person will usually ask for a promise. So don't hurt yourself. Can you make it a few more days? It's very common and, to my mind, very ineffective. But people who are threatening themselves or distressed sometimes expect to be asked to promise to do better, to feel better, to not take extreme action. And
you said you got an aura or a sense.
yeah.
Had she explicitly said something? I'm thinking about ending it,
No.
or life doesn't seem worth going on.
No. She was a beautiful young woman who was ready to move on with her life, but there was, and I don't remember if she discussed feeling depressed. She must have, but I can't answer. It was a very long time ago, and I don't remember why. The second one, I was pretty sure, because she was so angry and insistent that if she had destruction in mind, she would have been had that urgency and kind of intensity of action. But then the second one, I thought, well, the promise to everybody, because these were colleagues of hers, and she had made it in a public space, that there would be a certain, I think this is so, a certain shame in breaking the promise that you had made in front of everyone.
Okay. I want to hear what Terry's going to say, but
Yeah.
I wanted to add, if I could add just one more element. In both cases, they were a relatively small request or promise. Send me a postcard.
Yes.
It was, give it some time. Don't, think it through thoroughly. So it'd be relatively easy for her to agree to the promise. You got your foot in the door, or you got a small change, which could then lead to other changes.
Yes, and because you can secure an important relationship with a small action,
Yeah.
that whereas it's very difficult to get a big promise like don't do anything rash ever, but do keep our relationship in the first case, and in the second, it's a little more risky, but an attempt to have the other person demonstrate trust when she can't trust anyone else, to demonstrate trust rather than to ask her to be trusting. So that's, in retrospect, how I saw it. At the moment, it's something you have to do or not do, because I wouldn't be seeing these young women again, probably.
Well, what I find really fascinating is that what you're really talking about is the difference between direct interventions and indirect interventions. And that oftentimes people think that brief therapy focuses a lot on problem solving. Why don't you try this? If this is not working, why don't you try this? But sometimes the power of interventions are not direct. And that these are excellent examples of activating someone's internal process indirectly, rather than directly focusing on, I think you should think about how beautiful you are. Yeah.
Yes. And yet it's got the same social structure,
Yes.
Terry, which is why it can be powerful. If I say to you, meet me for lunch, it's a trivial event, but you're liable to make good on the promise.
Yeah, and that's
and
the
so
key.
am I.
The key is knowing when to make direct interventions and when to make indirect interventions, because you had a sense that if you told this woman, go home and think about how beautiful you are, that would not be as effective.
Right.
But you sense that this indirect kinds of interventions really activated something in her that then she was able to make use of.
I think that's right, and as is true in lots of brief interventions, the therapist tries to get a commitment to action. So even if it's wear different colored socks next time you visit your mother-in-law, those kind of facetious sounding interventions, or send me a picture postcard every week, so that it seems like not much, but in the first instance, to say send it in perpetuity, to use that odd phrase. So she has to kind of think about, well, what does that mean? Well, that means always forever. Oh, okay. She's already made the promise, now she's stuck. It's brush and floss and never miss a day kind of thing. So, and I like those because they are very brief but had longer lasting effects. So that the brief therapy is carried on relationally by the patient,
And it's
rather
lovely
than
that
by
she's,
regular meetings with the
Yeah.
therapist.
and that she sends you, I don't need to keep writing you because I'm having all these wonderful things and life is good, and that's lovely.
Right, she decided on the termination. And I don't know what else happened with the woman in China, but the power of saying something in front of a whole group is
Public
very
commitment
strong.
is a very strong,
Well, especially in a
Force.
culture where there's a great deal of, faith and a great deal of pride and a great deal of, image, and certainly a very collectivist culture puts a lot of emphasis on how one appears in public.
Yes, and I guess if I did it right, it was also resting on that base that she was in front of many people who knew her, and might have had close relations, work relationships. So,
cool.
yeah, there's something about in brief therapy that I keep emphasizing in my mind anyway, in my practice, about using the social situation as the leverage for change, in distinction to analytic therapies where they imagine they're using the interior self-relations as the engine of change, with a kind of
It's really
container
contextual,
in
systemic.
the transference.
Yeah.
Like that.
Well, you might also say that that's the power of other techniques like using reflection groups, where the reflection group adds so much emphasis and creates so much intensity from the affirmation, the positive affirmation of the reflection group.
Yeah, and I think You have a lot of experience with the one-way mirror
Mhm.
approaches where you have either a senior therapist and/or students and colleagues behind the mirror who are offering advice or comments or even interventions to the therapist and client in front of the mirror, or the family and the therapist. That has always seemed to me a very powerful way to influence people in the same sense that, coming up to the altar to declare your faith helps with faith healing.
Yeah,
Or
I
with-
think it's
yeah.
all about the energy. I mean,
Yeah.
the energy is very, very intense and has a very different level of connection, commitment, and transaction, basically.
Using the audience is wise. I remember once seeing Salvador Minuchin, the family therapist, and he was working with a family with an anorexic girl and the father and the mother. And there was an audience. I was in the audience with a couple hundred people. And came some point and he said something, and the father was somewhat rude and resistant and said, "Well, what do you know anyhow?" And Minuchin looked at him and smiled very kindly and then looked at the audience and he said, "I can assure you all these people came to hear me." And he didn't say it like to put the father down, but to say, I have some value to offer you and your family here.
Yes.
And the father got it. Oh yeah, he is famous enough that 200 people paid a bunch of money to come and hear him talk today. He must have something to say. And I thought it was a brilliant use of the audience rather than pretending we weren't there. He was kept us out of the picture until it was useful to put us into the picture. Yeah.
Yeah. Well, I like to offer an example that's
good.
actually much more direct, where the therapist myself actually offers what I would call the shift in the frame or the meaning, and that a lot of our work really is changing meaning, or in strategic therapy we call it the frame of reference or the frame of understanding of the problem, and so. Narrative therapy calls it restoring or changing a narrative. Strategic therapy calls it reframing. Solution-focused therapy calls it changing the thinking and doing. Pretty similar. Everyone does it slightly differently, and I'm going to describe a little bit about how I do it. The importance of changing the perception or meaning is oftentimes the key to change. And so there's one case involving a 16-year-old Latino American teenage boy who comes in and says, I'm suicidal because my brother just got killed in a gang violence, gunshot, death. And he says, I'm very depressed and I want to give up because here I am working extremely hard. I've busted my ass trying to get good grades and planning to go to college, and yet my cousin died of gunshot violence. My uncle died of gunshot violence, and that there's so much, violence and terror in my community. Why should I go on? Because no matter how hard I work, I will also get shot and die in this kind of gun violence. And so basically his perception is that I am powerless against all these forces against me. And so what I said to him was that I really think that it's important to understand that life is a series of battles. And that you are in a situation where every battle is an increased fierce battle to survive. And that in order to survive, you have to be strong in the mind, body, spirit. And that people think that they focus too much on being strong physically. And they feel like they should use their physical force to overcome others and so on. And the reality is that the most powerful thing is not physical power, but mental power, and even the most powerful is spiritual power. And that in order for you to survive, you have to really be able to strengthen your mind and your spirit. And that's what's the challenge is. The challenge is that no one can destroy your spirit unless you let them. No community, no violence, no situation can destroy your spirit unless you let them. And ultimately, you have a powerful spirit to have survived up until this point, and that is not that you are weak or vulnerable and that that's what leads you to think the way you do, but that you're tired, you're exhausted, and it makes perfect sense. It makes perfect sense that all these experiences have exhausted your spirit. But how do you reactivate your spirit? And then we talked a lot about, can you think of people with powerful spirits? Can you imagine people with powerful spirits? And we started talking about Nelson Mandela, you know, how people tried to lock him up in jail, beat him up, but they could not destroy his spirit. His spirit became even more powerful as he was released. They were forced to release him. Gandhi, they tried to beat him up, put him in jail. They did not destroy his spirit. Cesar Chavez, you know, they tried to beat him up and put him in jail, could not destroy his spirit. And then we talked about people in his life that have powerful, strong spirit. And he said his mother. He said his mother was the reason why he survived as long as he did. And his father wasn't around and so on and so forth. So we basically talked about what would help you activate your spirit. And of course he, you know, really didn't, you know, have an idea. And I said, well, in Latino culture, I'm guessing that a very, very important principle is honoring your brother. And he says, yes, very important in Latino culture to honor my brother. And I said, what do you think you need to do to honor your brother? And he said, well, I don't know. I said, well, just think about it. Did your brother want you to go into the gangs? He said, no, he did not want me to go into the gangs. Did your brother want you to drop out of college? No, and not go to college? No. He wanted me to go to college. He wanted me to be able to, you know, break out of this, you know, violent community and so on and so forth. He wanted me to be successful and so on and so forth. So are you going to honor your brother? Yeah, and that's the question for you. Are you going to honor your brother? And he says, yes, I'm going to honor my brother. And then I said, what about your mother? He says, I'm going to honor my mother. And so we talked about how to activate that powerful spirit in order for him to fulfill his honor. So this is an example of actually directly intervening with guiding the client into a different perception of the situation, that he had the power to overcome whatever the adversity was.
I like very much that you began by a compressed and very empathic understanding of the awful tragedy in energy terms, where you'd say, well, of course, this has worn you thin or exhausted you. Essentially, how could it not? And then, as very good solution-focused therapists do, to start talking about what the remedies or antidotes are for those awful feelings, rather than to try to describe the origins of the feelings. You take them for granted. Well, of course you feel knocked out, you know. And now what other people have felt that way? Well, these important public figures. And what about in your family? So by the end of your interaction with him, you have his recommitment to honoring his brother and his mother, and therefore becoming a person of great spirit. And it's very beautifully done because the feeling is like a proof. You say, well, since this, then that, and since that, the other. And if this, Well, don't you agree?
Mhm.
And he says, honestly, yes, I do. Of course, I want to be a man of honor, essentially, not a remembered as a suicide or a gang member. It's very, very pretty work.
Yeah, so I just want to acknowledge the point you made, and that is it would be tempting for the therapist to give him a lecture, you know, about all the things he should do and all the things he should be feeling. And that is the difference between our work. Our work is guiding the client to their own realizations and their own commitments.
Yeah, and that the social concept and cultural concept of honor has lots of applications.
Yes.
And they're kind of conventionally understood. Like the concept you had mentioned from Oriental cultures in general of face.
Asian culture, yeah.
Or in Asian cultures.
Yeah.
So, and then taking another thing I think important in these ways of working is having the patient demonstrate expertise. That young man is an expert on Latino culture, on the concept of honor, on family relations, and more intimately what his brother would expect of him and his mom. And all of that done gently and persuasively is very beautiful kind of accompaniment to somebody in great distress and leading them out as though you had a blindfolded person leading them out of a crash site.
I think it was the French philosopher Blaise Pascal who said an idea is more likely to be accepted if it is experienced as arising in the person's own mind. I thought of it rather than somebody told it to me. And I would kind of dovetail that with the Ericksonian concept of utilization. The close family tie that was causing him so much grief and sorrow was also the close family tie that you activated in the positive sense.
Good point.
You can't do yourself in because you're hurting. It's because you loved your brother, and since you loved your brother, you have to respect him. And this is a way to utilize the power of that relationship for a good reason rather than just and as you said, first you have to acknowledge the painfulness of it, but in the painfulness of it, there's also a key toward a solution to utilize. It means so much. As I'm listening to you talking, I'm thinking about cases. Oh yeah, it's just fascinating.
Yeah, I just want to also confirm what you just said, is that the idea of like redirecting the energy, the loving energy he had for his brother was directed towards kind of like giving up and you know, sort of sacrificing himself, when in fact we redirected the energy to a constructive purpose to actually make his brother proud of him and therefore constructing something honorable for his family and for him.
Yeah, and that is kind of our mutual instinct with these people who were at risk of suicide or of despair, to say, well, you know, here's something you can do, and that opens a kind of future. If he were to be honorable, well then he has to be active. He has to study hard or work hard or comfort his poor mom, who after all lost dear relatives too.
Yeah.
And all of that without a sort of hint of instruction. Well, here are the 10 steps by which you can
Or don't you dare and count your blessings and give me a promise and all of the usual, which you can do and sometimes are helpful to do, but it's done much more elegantly and more empathically. It's within his frame, reframing same facts, different meaning. So the facts are the brother was killed and he's grieving, but he takes on a very reframed, a very different meaning. This is a way of honoring your brother, not just, or you know, how will you grieve? Well, the best way to grieve is to remember him in a positive way, which is what he would want, wouldn't he? Yeah, it's nice.
It also shows that grief therapies are also derivative of the family therapies. So that you thought in terms of the whole family concept of honor, the spirit of the great men was one thing, but the spirit of family relations also. Well, you honor your mother and father, your brother, and in Latino culture, notoriously, the prominence of family as the most valuable set of feelings, commitments, responsibilities, pleasures, and connections. So you have a lot to work with when you're framing things that way, I think.
Yeah, and I didn't mention this part because I had to keep things relatively short, but I also mentioned to him that where we draw our spiritual strength really is from family. And he openly acknowledged that, as I draw strength from my mother. And so this is where we can draw more strength.
I think some of what we're doing, it's wonderful, and we're talking about techniques, interventions, strategies, logics, maneuvers, and it's great. And what also happens is this alliance, this empathy, this caring. He trusted you. He saw that you got him, that you understood something about family and connection and the seriousness of what he had suffered, and the two women you talked about.
Yeah.
And I think a lot of times brief therapists, we so quickly get into talking about the technique, what we did, or the strategy, that we forget that it happens within a relationship. And without the relationship, nothing would happen. The techniques have to grow in the soil of the relationship. Otherwise, it'd just be throwing ideas at somebody.
Yeah, and I think that's exactly right. That when I teach therapists, I want them to feel a great deal, not to be only strategic, but to understand that what you're talking about, Michael, and what Terry has been demonstrating all along this, softly focused attention between the people.
What is sometimes called, in a different model, counter-transference, my reaction to your transference. I usually think of it quite differently. I think of it as client-inspired therapist contribution.
No, it's an interesting term.
Client-inspired, they stimulated something in me that got me to think of something, to see it in a positive way. I had to have, as Terry did, a knowledge about families or Latino culture or brother relationships. It doesn't necessarily have to be any one culture, lots of cultures. But something about them, it happens between us. The therapist is very much a part of it. It inspires something in me and gets me to frame or to think about things in a certain way. That's one of the reasons I'm usually unhappy with role-playing exercises, because it doesn't feel real and it doesn't do anything for me. We're kind of where if it's real, then it activates me, as opposed to I'm sitting there trying to, now what's the question I'm supposed to ask, kind of thing. Let me tell you about another case, just to kind of see what you think about this one. So a woman called saying that she needed to learn how to deal better with her father, who was in jail. Her mother had divorced the father when she was a little girl, and the father had drifted off, and he was sort of a bad guy, barroom brawler, drug addict, all sorts of problems. But every now and then he'd call and he would harass her. I want money, I want to come over, you got to give me something now. And he was currently back in jail, and he was repeatedly calling her, just come and visit me, bring me some money for cigarettes, something. She said, I don't want to deal with him, but I'm a nervous wreck. And I listened sympathetically for a couple of minutes. We made an appointment. I got some basic information, her age and phone number and that kind of thing. And then I said, think about sometimes when you've been able, even just a little bit, maybe to stand up to him or say no, because that may give us some clues to what could be helpful. She said, okay. So when she came in, we started the session. Excuse me, she began by describing the history. She explained his barroom fighting, his drug abuse, his demands and threats against her husband. She said all the other members of the family had had it with him and wouldn't put up with him at all. But I'm the last one. I get all shaken up and I fall apart. I don't know what to do. So I said, so other people in the family know how to deal with them, huh? And she said, yeah, but and that helps a little bit, but I'm just a nervous wreck. I don't know what to do. And I said, I've got an idea. Let's do an experiment. And I stood up and we walked over to my office door, and I opened the door, and I said, imagine he's standing here. What would you say to him if you wanted him to go away? And she said, what? I said, well, just imagine I'm right behind you here, but just what would you say to him? What actual words would you use to say to him? And she said, well, I can't talk to you. Go away, go away, go away. So we stood there for a minute, and we went back to the chairs. And she said, I'm still nervous. I'm not sure what. And then she went on to tell a story about some time she had actually let him into her house, and he had said something very offensive and rude to her. And she was outraged, offended by it. And you could see when she said it, she said, no matter how sick anybody is, no one should ever talk to their daughter like that. And I said, of course not. And I said, when you think about that, you're not feeling guilty or codependent. You're angry and you're ready to shut doors, slam doors, hang up, do whatever. She said, yeah. So we talked a little bit more about it, and she had the idea, well, but I'm the last kid that'll do it. And she said, and I said, but you've been helping him for years. You're the last one, so you've been doing this longer than anybody in the family. And you can see a little light bulb go on, like, yeah, I don't have to feel guilty. I've done more than anyone. On a follow-up, she said, I realize I'm not the welfare department and I don't have to pull this load alone. So, we talked, so she said, I think I'm ready. I'm going to stand up to him. And so we rehearsed it a little bit. What are you going to do? How the phone call? What would be the first thing you'd say? How about if he does this? How about if he does that? She said, this has been really helpful. I said, want to make another appointment? She said, let me see how this goes. I think I've got what I need here. I said, can I check in with you in a couple weeks just to see how it's going and call me sooner? Yeah. So a few days after the appointment, father called, and she said, I don't know. So we got him off the phone. He called back a day later, and then she said, listen, I've gone to talk to a counselor, and I've decided you're not welcome here. I don't wish any harm on you, but if I ever want to talk to you, I'll talk to you, but you're wasting your time. If you call again, I won't even pick up the phone. Leave me alone. Sorry it has to be this way. Goodbye. On a follow-up, and we did a couple of follow-ups, she wasn't feeling guilty. She wasn't feeling distressed. She did not feel she needed to come back. Now, I don't know. Today, as we speak in San Rafael, California, he may be knocking on her door. We don't know what will happen long term. But this empowered her. It gave her a sense that she could do something. It used her resentment and anger in a positive way. If you're going to talk, nobody should talk to their daughter like that. Think about that, and you're not guilty. You're not shut down. You're ready to,
I want to say that thinking like a hypnotist,
Yeah.
I noted what you did after your disclaimer about role playing. That was very, very good. Where you opened the door and there was nobody there. You said, well, imagine him there. That's easier than here's what you're going to do when he shows up all big and angry. And then you said, and I'm right behind you. Like it mattered.
I had not thought of that.
No, but it's what you did. Said, and I'm right behind you. And of course, you're big and comforting and have been sympathetic with her. And I know that worked as though a post-hypnotic suggestion because she started her
I'm right with you.
brave
Yeah.
thing by saying, I went to see a counselor.
And he's right behind me here. You can't see him, but I can.
Yeah.
I mean,
I went to see a counselor and I've decided blah, blah, blah. Is backup. We had the school conference and the reading teacher said such and such. And so I decided I'm not going to let you blare the TV while our kids are doing their reading homework. So it gave her the backup that she was lacking to meet this rather large, menacing, and difficult
now
situation.
she's got somebody on her team.
Yeah, that's right. That she had more than herself and her self-reflections. She had nobody should ever treat someone that way. She had the social backing, and she had the backing of a large, strong man, her therapist, And then she was able to use her own strength for good family purposes. She wasn't, intimidated.
Well,
pretty
certainly
nice
this,
work.
this is an example of multi-level, processes of impact. So there's direct, impact where you're expressing certain ideas, and she sort of gets new ideas, and
Yeah.
then there are all these other indirect kinds of forces that also impact.
Yeah, it's interesting to hear you say that, Terry. That what Michael did was in some aspect indirect.
Yes, exactly. But in some
As
ways
though
direct.
direct were, I'm going to tell you
Yeah,
what
right,
to
right,
do.
right,
and-
right, yeah.
But is it not direct in a social sense if I say, I'll be right behind you?
Yes, yes, yes.
You know.
It is fascinating to consider.
I also
these.
said to her, tell him whatever you'd want to tell him so he'd know that you're not going to take this from him anymore, that he should
Yeah.
go away.
So-
I didn't say the following words and the
Yeah,
following word
right,
3
yeah,
times.
yeah.
So I kind of gave her a general directive, if you will.
Yeah.
Assert yourself, but assert yourself as you know how to assert yourself,
Yes.
rather than the way
Right.
I would instruct you how to assert yourself.
Which is another form of backing her up. Say, well, in this convention of Erickson's and other therapists, well, you already know what to do. And that's like, well, show me that what you will do as a kind of practice. It's almost like an athletic practice. Well, if you're going to hit the middle irons, let me see your grip. So that, again, the client becomes an expert.
Yeah.
Say, here's how I'm going to tell them not to mess with me.
And all of these unspoken kinds of messages that are implied that clients pick up, and the idea that my therapist believes I can do it.
Yes.
Very powerful, but so unspoken
Yes.
messages that are coming across.
And the client has come now for a reason. I've had it, I'm tired of this, I want to make a change, I just need a little hint or a little help, maybe more than a little, but seize the moment, strike while the iron's hot. Shakespeare in Hamlet says, the readiness is all. It's like
Yeah.
when they're ripe, now is the time to do it. Where if I'd seen her a month earlier or a few months later, it would have just been a whole different thing. Wouldn't have been, but she's...
Do you guys have a way of characterizing the emotional attentiveness that all of us are indicating is the initiating strength of a brief therapy or strategic therapy or even a family therapy, that there's an emotional attention with the person?
Jay Haley, once in an interview, said that he was asked if there's one thing you could teach your students, what would it be? And Jay said, I would teach them to love their clients.
That's what he said.
And he did not mean romantically or
Right.
sexually.
No.
He
The
meant
caring
have a
part.
deep, abiding, caring, have respect in them, believe that they have something good, some strength. And so I hear sad stories. People are abused and raped and deaths and discrimination and just, all the horrible things that go on in people's lives. But trying to kind of, what about them can I like? If they were, I don't always think of it as if they were a member of my family and I was really sympathetic and looking for the positive, what would I see in this person? Even somebody who's, boy, they sure have strong feelings. They're intense. They don't take, abuse. But to look for something you can empathize with in a positive way and see as a value.
Something you can genuinely admire.
Yeah. That's
Well, I give you an interesting example of working with kids that are oppositional and defiant, which oftentimes are very, very challenging. And so basically, this kid was, I forgot how old she was. I think she was 9 years old, and she was really defiant and oppositional with the mother. Her mother, would have difficulties, setting firm limits on her. And so I separated him and worked with the mother and really acknowledged, how much she's endured as a single parent and how much, her daughter really cared about her and loved her. And after this conversation, she says, well, I get it, I need to be more firm. Well, I didn't say that. But in the process of acknowledging her strengths, she got that herself.
Yeah.
That she just sort of suddenly got into, yeah, I think I need to be more firm, which is a really interesting, part of our work, is that as you build strengths and strengths, the feeling of strength actually brings out the solutions inside the person. So that's one part. The other part is working with the kid. The kid refused to talk. And so I basically brought her in with the mother, and then I said, what we're going to do is, since, so-and-so really is not, in the mood to talk, we're going to pretend she's not here, and we're going to talk about her. And she says, but I'm here.
Oh, that's
I'm here. Oh, okay, but let's pretend you're not here. And she started laughing and said, since, so-and-so is not here, we're going to talk about all the good things about so-and-so. But we don't want to say it too loud because then she'll hear us. And then what will happen is she get too embarrassed. And I went like this to her. I said, then she get too embarrassed. Then she laughed again. It's one of the most successful sessions. She dramatically changed after that.
That's funny.
Boy, is that well done.
I find if parents show up, I used to find it annoying, but they would come with their little baby because they couldn't get a babysitter, and the baby would cry and carry on and disrupt the session. Now I find it's much more useful if I say, oh, can I hold your baby for a few minutes? And I hold the baby. Why? And I talk to the baby. So do you think your dad is going to learn to control his temper and be nice
That's a good
so that he won't ruin your whole life and get divorced and have to move away? And do you think mommy's going to stop being so angry at him? And since I'm talking to the baby, they can overhear it or listen. Oh, I'm sorry, we're having a conversation. You guys work your thing out here. You don't do too much of it, but it's a way to slip in things under the resistance, under the radar, if you will.
Yeah, and I like a similar thing with people who have poor self-regard. And I'm fussily not keen on any of these hyphenated terms, self this, self that, self the other. Even though I understand it's hard to make arrangements with yourself and all that stuff. But what I like to do for somebody who doesn't have a good regard of their appearance or intelligence or something is to dissociate it so that they're talking about the person on the couch who just happens to look exactly like them. And, suppose you saw your friend Terry over there. Tell me about how he looks to you. And you get a more positive view because it's external. Mm-hmm. I think it's similar to what you guys are talking about, that you're taking a separated view of the person rather than a direct one. You say, well, we'll talk about your daughter. We'll talk about you, but in whispers so you won't hear and make you embarrassed. So that you then come back to something very immediate is kind of jarring in a good way. And that like the light that you saw in your patient saying, oh, hey, I could do this. I have a way to do this. And then whoever you're working with takes the ball and runs with it.
So part of it is gift wrapping it, presenting it, selling it, whatever metaphor you like. Whatever we're offering the people, we're selling them themselves. What's that famous book, Selling Water by the River?
Yes.
Right. We're trying to offer them better parts of themselves, but we have to do it in some way that's acceptable to them. And if it's too direct, they resist it. If it's too subtle, maybe it goes over and they don't get it. But it has to be something that they can connect to it in some way. And that's, I think, where a lot of the art is of when do you talk about this? When do you talk about that? When do you do it indirectly? When do you do it? I can give an example where I told somebody a joke that it was helpful to them, and they had previously been told they had a drinking problem. No, I don't. My wife says I drink. And I could see it seemed very likely that there was some accuracy to the assessment that the person drank too much. Some of the stories they told were certainly under the influence stories and got them in trouble. And so I looked at him and I said, you know the one about the guy who walked into the bar at 5 o'clock? He said, what? And I said, well, so this guy walks into a bar, tavern at 5 o'clock, and he says, I'll have 3 beers. And the bartender says, okay, pours him 3, and the guy drinks the 3. Next day, 5 o'clock, comes in, 3 beers, please, and he drinks 3. Next day, 3. And the bartender says to him, you know, you're welcome, but I could pour you 1 at a time, and then each one would be cold and fresh instead of 3. He said, well, here's the deal. Every day, my 2 brothers and I, when we're not together, we each go to a tavern and we order 3 beers and we each drink the 3 beers. Then we have a drink together every day. And the bartender says, oh, it's a little odd, but okay. And so then the guy, I'm telling this to my patient, he's looking at me trying to figure out what's going on. And I said to him, so this happens day after day, 5 o'clock, 3 beers. And then one day the guy comes in and he says, I'll have 2 beers, please. And the bartender says, okay, but did something happen to one of your brothers? And the guy says, oh no, I quit drinking.
That's a good one.
That's very nice.
And it's very funny, and you know, we laugh, it's funny to tell it, it's fun. And you could see, it's like, humor goes to places that not even WD-40 can get to.
Yes.
You know, it gets them unstuck, and it's undeniable in some ways. You know, you're telling yourself you're not drinking, but you're still drinking. Yeah, you can spell it all out. He got it. He came in a couple of weeks later, and we're talking about other stuff. He said, you know, I haven't had a drink in a few days. And, you know, pardon me, I want to go, because of the clever thing I did, and I go, oh, well, good, you know. How's that going for you? You know, and just sort of, don't want to make too much of it because I don't want to stimulate. But somehow I think it tipped something, and he had to hear it in some way that was that he could get it, and he got it with a laugh. Humor can be useful. A song lyric, something we just saw on the news. You know, but something. But how to know what to do when? That was sort of what we were discussing in our last one.
Yeah.
The art, I don't know. I could occasionally say, well, experience or, but why you do something instead of something else? When should you be indirect versus direct? When should you be instructive or confrontative even? There are people who I've just banged my fist down and said, you got to stop that.
Yeah.
Not often, but sometimes.
But you could. Yeah, I think a partial answer to that is how each of us might think about what we do, even though it's not a great answer, or what we pay attention to. And in my case, I'm looking for a story of some kind, or an image that I find interesting, and then I somehow connect it with the progression from the problem to a solution. And so in the postcard story, I like that shop. I want to have something that I like, admire, that I have positive feelings for.
Yeah.
And since I admire all kinds of competence, all I need to do as a proxy for what you're asking about is find what somebody's good at and sit and listen to them talk about it. As I'm feeling here when I hear you guys talk about doing therapy, and I think, boy, they're good. How did they do that? Well, that's something. And I'm intrigued, as though I were watching my wife paint a picture or something, and I said, boy, how the hell does she do that? Or anything of competence, like a mechanic or a short order cook. And since everyone has got some competence, then that becomes leverage. Your patient's competency was cultural. He knew about honor and about family. And since he knows that and he's an expert, or your patient knows in some way how to talk to children and adults, how to talk to family members, how to put your foot down. And those become competencies that you can admire and absorb yourself in as a therapist. It makes a very good connection. I always think, and I may even said that in our first meeting, of what happens when you walk into a house where there are kids and they don't know you, but you know the parents. One of the kids is going to come over and say, "Do you want to see my room?" And then you go down the hall and suddenly they're expert guides.
Yeah.
They show you the stuffed toys and the Legos and stuff. And that forms a connection that gives both parties influence. You're influenced by your patient's struggles, and you influence your patient's pathway from despair and suicide. So I think that's a kind of verbose
If you spent
way
the
of talking about
hour
it.
interviewing somebody about what are you good at and what are you grateful for, what's right in your life, what is the,
Yeah.
by the end of the hour, it would shift so much. Like, oh, yeah, I've got lots of things to look forward to, and I'm really pretty competent, and I'm very good at this, and I'm okay at that. It would counter demoralization. It would counter incompetence. It would counter all those, I'm broken kind of feelings. I'm looking at our time. We've got
Yeah.
about a minute and a half, and I want to reserve the last 20 seconds to invite our audience back for more. But what y'all want to say here?
Well, I just want to end with the two major things that I really focus a lot on in my teaching, and that is, one is the therapist is the therapy, and that is the therapist brings himself or herself to the therapy, and it is the use of self that we're talking about. The other is entering the client's world. That's also what we've been talking about,
Yeah.
and that is to be able to see the world the way the client sees it, then to process that world in a certain way that's helpful and therapeutic.
Yeah. That describes what we're all doing when we do it well, and it feels and sounds pretty seamless. Perhaps next time we'll talk about some of the times that we're helpless in the face of what's happening, or have
maybe.
difficulties that are shared with the client.
What do you do and what you usually do doesn't work, or
Yeah.
when you're stuck, or what's plan B, or, that'd be interesting. Just hearing the two of you talk about cases, and we each have our own slightly different ways of thinking and looking. It's just fascinating. And I hope that our audience will join us when we have our next conversation, more on modern elements of modern brief therapy. And again, Terry Suhu, Eric Greenleaf, I'm Michael Hoyt. Thank you for being with us.